thank you, Access Health, for having me come in today. Appreciate that. And I'm going to tell you a little bit about NAMI Connecticut, but first I want to talk a little bit about how I came to be in the role that I currently hold here at the organization. Because by training I'm an engineer and was involved in the computer business for a number of years before I got into the nonprofit world, and never in my wildest dreams did I think I'd work for a nonprofit doing communications, and especially a nonprofit dealing with mental health. But funny thing happened in life sometimes. And in order to tell the story properly, we go back in time to the fall of 1998 when my son was entering his senior year in high school. And up until that point, you know, John was like the all-American kid. He was on the honor roll, he was on the wrestling team, he was a good-looking kid with a great circle of friends, and his life at that point looked like he was on a trajectory to graduate high school, go off, get a college degree at some school somewhere, and go out, get a good job, and live the American dream. Unfortunately, the wheels started to fall off that dream in his senior year in high school. We started to notice some kind of interesting behaviors at home, and then we started getting notices from the school that he was cutting classes and not turning in assignments, and not long after that we got a notice that John was in danger of not graduating. And his mother and I are like, how can this be? How can an honor student not graduate high school? You know, what's going on here? Well, what was going on was John was developing bipolar disorder. And that began what I like to describe as an 8-year-long roller coaster ride of every parent's nightmare. John was drinking and drugging, he was getting into trouble with the criminal justice system, he was homeless at various stages during that 8-year period. He was in and out of the emergency room and inpatient psychiatric hospitalization. But worst of all, because he had bipolar disorder, he was at times suicidal. And in fact, he tried to kill himself. I can't even tell you how many times, because honestly I lost track. But 2 of the attempts were at home. The second attempt was in front of his sisters, who were 3 and 5 years old at the time. And it was at that point my wife and I made a decision that no parent should ever have to make. It was, you know, John, we love you, but you can't live here. There's just way too much chaos and drama in our home. You know, it's supposed to be a safe space, a place of refuge and recharging, and it's just way too much chaos and drama. The good news was, is right around this time, my wife heard about NAMI, the National Alliance on Mental Illness, and she dragged me, kicking and screaming, to my first NAMI support group. And I say that because I'm a guy, and you know, we don't like to ask for directions, we don't like to ask for help, very self-sufficient. But I went, you know, and a lot of it was based on my misperceptions of what people typically perceive when they think about a support group. You know, you go with what you've seen on television or on, you know, movies, and it just, most support groups are like just not great places. People are mean to each other, and it's just, you know, not something you want to engage in. How wrong I was, because the NAMI support group was just fantastic. It was facilitated by people who had been trained to facilitate a support group, but more importantly, were people with lived experience, people just like me who had a loved one go through a serious mental illness and knew about how to access the fragmented mental health systems we have here in Connecticut, and knew what we would expect, you know, from behaviors and the typical trajectory of these illnesses. So not long after that, we signed up for one of NAMI's classes, the Family to Family class, which was just a lifesaver. I mean, I tell people all the time, if NAMI as an organization did nothing else but do this one class, the Family to Family class, it'd be a great organization, because while I cannot prove it saved my son's life, it absolutely saved my marriage, because my wife and I were like this about what to do about John. So anyway, fast forward through that 8-year stretch, John is now doing fantastic. He's been clean and sober for over 10 years. He's been working steadily during that time. He actually bought his own condominium with his own money about 7 or 8 years ago. He got married a little over 5 years ago. And 2.5 years ago, he had his first child, my first grandchild, Miss Sophia. I can show you pictures later if you want to see them. But his life regained that trajectory it had been on before he got sick. And there's a reason I tell this story, a couple of reasons actually. One is for anyone who's going down a similar path and is new to this whole mental health thing and has got a loved one who's not in a good place, you should never give up hope. I mean, John was a mess. You know, there were many times that the phone rang late at night. I was convinced it was the police going to call and tell me where to come to, you know, identify his body, because I just didn't think he was going to make it. But he did, and he's just one example of people who had a serious mental health condition but made it through the other side. The other reason I tell this story is because of stigma. A lot of reasons that people don't reach out for help and for mental health conditions, the typical time between the onset of symptoms and the person reaching out and getting help is typically 10 years. Now imagine that. Imagine if you had a broken arm, you had cancer, or some other serious health condition. Would you wait 10 years to go get it checked out? Probably not. But because of the stigma, people don't engage till they've really suffered for quite an extended period of time. And the only way we'll get rid of the stigma is to tell our stories. So that's one of the reasons I always tell the story whenever I talk about NAMI, because it's just really important we get rid of the stigma. I mean, the statistics are really sobering too when you think about it. There's 1 in 5 Americans at any given point in time is dealing with a mental health condition. So really, everybody knows somebody, but it's just because of the stigma people don't like to talk about it. So NAMI is a wonderful organization. We do basically 3 things, and I've already touched on a couple of them. We do support in the form of support groups, family support groups, caregiver support groups. We also do support groups for people in recovery. And that comes in several different flavors. We have one specifically for veterans, we have another one for young adults, and then there's just the general NAMI Connection support group for just anyone in recovery who wants to avail themselves of a support group that's, again, held by people who've had trained support group facilitation training and are knowledgeable, but also have lived experience. For education, again, I touched on one of the classes, the Family to Family class, which is a 12-week class. It's a wonderful class, talks about the different types of mental illnesses, talks about the different types of medications and what they do and their side effects, talks about the typical behaviors you're going to experience with someone who is in a mental health crisis, what you can expect to see as far as their symptomology and how they're going to react to it. But most importantly, for a family in crisis, it talks about coping skills. How do you maintain your own sanity? How do you take care of yourself when your loved one is struggling? And let's face it, if you're not in a good place, you're not going to be able to take care of your loved one very well. So that's Family to Family. We have other classes too. NAMI Basics is a similar class to Family, but it's specifically for parents of school-age children, because let's face it, when you have a school-age child that's dealing with a mental health condition, where does that child spend most of their time? In school. So it talks a lot about dealing with the school system and how do you access accommodations for a child that's struggling, you know, the individual education plans and the PPT meetings and all that good stuff. We also do provider education. In fact, just yesterday I was over at the Department of Children and Families office in Manchester. We were doing a provider ed training there for some of the licensed clinical nurses and social workers and people like that who are delivering services to families throughout Connecticut. And we talk about what mental health is all about, but most importantly for these providers is how important it is to understand the impact on the family of the loved one who has the illness. Because a lot of the training that goes on for these professionals talks about the person with the illness, doesn't talk at all about the impact on the family, and that someone with a serious mental health condition is not only, you know, really struggling and often been traumatized, but the family is traumatized as well. And the family can be a great source of help to the person that's struggling, but they need to be part of that whole team. And if the professional community understands that dynamic, and we teach all about that in that particular class, they can be much more effective in dealing with their client and helping that person get to a better place. So that's the Perspectives class, what we call provider ed. Last but certainly not least is advocacy. We do legislative advocacy at both local, state, and federal levels. We have our headquarters down in the DC area. NAMI is an organization, is all within all 50 states. There's a NAMI in every state. Here in Connecticut, we're located right here in Hartford, and that's not by accident because that's where the state capitol is, and we're a regular presence at the state capitol, especially during the legislative session, which here in Connecticut, this is May 11th, it just ended on Wednesday, so we were very active following different pieces of legislation, attending the public hearings, you know, getting our voice heard for the people that we care about, surrounding any legislation that would affect the people that we care about. And we do that every year. We also get involved at local levels. We encourage our members to participate in their local communities, especially in regards to politics. And NAMI is kind of a unique organization. We not only have the headquarters down in the DC area and the state office here in Hartford, but we have 10, soon to be 11, local affiliates scattered throughout the state. We have a new affiliate coming online as we speak in Danbury, which we're very excited about. We also have in the works, which will hopefully come online before the end of the year, a Spanish language affiliate in Meriden. So we're really excited about that. That'll be our first Spanish language affiliate. So that in a brief nutshell is what NAMI is all about and what we do and how we help people.